Hey everyone, ever really stop to think about what getting older actually means? Like beyond just the birthdays and maybe a few more aches and pains.
Yeah, for sure.
Today we're going to dive into something you might not hear a lot about, frailty.
Right?
It's about how our bodies handle challenges as we age, and it's way more than just slowing down.
Yeah, it can be kind of a sneaky thing.
Exactly.
It's often something we don't really notice until, you know, until there's like a sudden health crisis.
You're so right. And that's what makes this deep dive so fascinating. We're looking at this insightful commentary from three experts in Singapore, published on CNA.
Oh, wow.
They're looking at how a place like Singapore, with its rapidly aging population, is tackling this issue head-on. So by the end of this deep dive, you'll know exactly what frailty is, why it matters so much, and what can actually be done about it. Trust me, this goes way beyond those typical retirement
Oh,
tips.
absolutely. We're talking about like a crucial part of aging that really impacts, well, individuals,
Hmm.
families, and even entire societies.
Yeah, it's huge. And to get us started, the article throws out a pretty startling statistic right away. In Singapore, 30% of the elderly are what they call pre-frail, meaning they're showing early signs, and another 5% are already frail. So that's a massive portion of their population.
Whoa, yeah, that's a big number.
Yeah.
It really highlights the scale of this. But before we go any further, I think it's important to clarify what frailty actually means, from a medical perspective.
Really?
It's not just about getting a few wrinkles or gray hairs. It's more like, that old car analogy
Okay.
where things start breaking down a bit easier and the system it has less reserve to bounce back from stress.
I see. So it's like the body's ability to handle a tough situation. It's kind of like wearing thin.
Exactly. That's a great way to put it. And this makes older adults way more vulnerable to things that wouldn't normally knock them down. Things like pneumonia
Yeah.
or a simple fall. Even the flu can turn into a much bigger issue. And the recovery, well, that takes longer, comes with more complications, and it just makes it harder to get back to doing the things they were doing before.
Hmm. That's really scary. That makes me think about all the discussions around President Biden's age during the election. Frailty is definitely something people are talking about more and more these days.
It really is. And it's so important to realize that this isn't just an other people problem.
Okay.
Think about your own family,
Right.
parents, grandparents, aunts and uncles.
Yeah.
Have you noticed even subtle changes in them? Maybe they're not as active as they used to be, or their appetite has changed, or maybe they just seem a little more withdrawn.
Hmm.
Those could be those early warning signs of frailty creeping in.
Oh, that's a really good point. And it's not always something that's super obvious, right?
Yeah.
This article actually tells the story of this 86-year-old woman. They call her MDMM. And she seemed perfectly healthy. But then she got pneumonia. And afterward, she couldn't even get out of bed on her own. It was like the illness just triggered this whole cascade of problems.
Yeah. Oh, wow. That's a perfect example of how even a common illness can drastically affect someone's independence, especially as they get older. It really highlights how frailty can be kind of hidden. Someone might seem fine, until they hit a bump in the road, and then all of a sudden those underlying vulnerabilities just surface.
It's a bit of a wake-up call, isn't it?
Yeah.
So is this just an inevitable part of aging? Like, are we all doomed to decline like that as we get older?
Well, here's where it gets really interesting. Research is showing us that frailty is often preventable and even treatable, particularly if we can catch it in those early stages.
Okay, that's good to hear.
It's not a one-way street.
So what kinds of things can make someone more likely to become frail? What does the research say about that?
Well, the article points to several key risk factors. Lack of physical activity is a big one, as you might guess. But then there's smoking, not eating right, and loneliness.
Wait, loneliness. I wouldn't have thought of that as a risk for physical frailty.
It's a growing concern, especially as more and more older adults are living alone. The article specifically mentions this is a trend in Singapore, and really it's something we're seeing around the world. Loneliness has been linked to not only depression, but also things like cognitive decline and even heart disease.
Wow, so it's not just about feeling sad. Loneliness can actually impact physical health that seriously.
It really can, and that underscores just how important social connections and community support become as we age.
So we got lack of exercise, smoking, poor nutrition, and loneliness all playing a role. What about chronic conditions? Do things like diabetes or heart problems make someone more likely to become frail?
Absolutely. Chronic diseases, especially if they aren't well managed, can definitely contribute to frailty. It's not just about having the disease, it's about how well you're controlling it. When those conditions are under control, the risk of becoming frail goes way down.
So it sounds like a lot of this boils down to taking charge of our health as we get older, being
Abs-
proactive about it.
Yeah, that's a great way to put it. It's about recognizing that aging doesn't have to equal this automatic decline. We can take control, make choices that shape our aging journey for the better.
Okay, so we've covered the things that can increase the risk of frailty. But what about solutions? What can actually be done to prevent it? Or even reverse it if someone's already showing signs?
Well, the article brings up MDMM again, and her story is actually a great example of successful intervention. She was able to regain her function through a combination of rehabilitation and community programs.
That's encouraging. So it sounds like a mix of medical care and social support was key for her recovery.
Exactly, and that highlights an important takeaway. It's not just about medical treatments. It's about taking a holistic approach. We're talking about addressing nutrition, making sure people stay physically active, keeping them socially engaged, and supporting their mental well-being. It's about all those pieces working together.
And with populations aging so rapidly in many parts of the world, building those kinds of support systems is going to be essential, not just in Singapore, but globally.
You're absolutely right. We have to start thinking about frailty as a public health priority, not just an individual problem. It's a societal issue that's going to require comprehensive solutions.
So instead of that old view of aging as just this slow, inevitable decline, we can actually start to see it as a path we can actively shape.
That's the key. And that's a much more empowering message, isn't it? We actually have more control over our aging process than we might think.
This deep dive is definitely giving me a whole new perspective.
Me too. It's a powerful reminder that the time to start planning for healthy aging is now, not later.
That brings up the biggest question of all. What can you do, starting today, to build a foundation for healthy aging, either for yourself or for the older adults in your life? We'll dig into some practical steps you can take in the next part of our deep dive, so stay tuned for that.
Yeah, looking forward to exploring those practical steps with you. It's all about empowering ourselves and those we care about to age well.
So we talked about how important this holistic approach is to preventing and even reversing frailty. But what does that actually look like in real life? Like, what can people actually do?
Yeah, that's the big question, right? It's easy to just throw out these generic tips like eat healthy and exercise. But let's get more specific. What are some actionable steps people can actually take?
Exactly.
Well, the article really emphasizes nutrition as a foundation. We're talking about a balanced diet, plenty of fruits and vegetables, lean protein, making sure you're getting all those nutrients that help our bodies stay strong and resilient.
That makes sense. But for older adults, especially if they're living on their own, meal prep can be a real challenge.
Oh, absolutely. And that's where those community resources we were talking about become so important. A lot of communities have meal delivery programs specifically for seniors or senior centers with communal dining.
Well, that's a good idea.
Not only are they getting nutritious food that way, but they're also getting that social interaction at the same time.
Oh, wow. I never thought about it that way.
Oh,
So it's like tackling two birds with one stone.
exactly.
Okay, so we've got the food part covered.
Yeah.
What about staying active? We're not expecting grandma to hit the gym and start pumping iron, right?
No, not at all. We're talking about finding enjoyable ways to move. It doesn't have to be super intense. It's more about consistency.
Okay.
Even a daily walk, maybe joining a gardening club, volunteering at a library. These are all great ways to stay active and engaged.
I love that. It's about finding things that bring joy and connect you with others at the same time. So hitting those social and physical needs all at once.
Precisely. And the benefits go way beyond just the physical. Staying socially active also stimulates the mind, helps fight off loneliness, and really contributes to that overall sense of well-being.
So important.
The article also spends some time on managing chronic conditions. How can people make sure they're getting the best care possible, especially if they're dealing with something like diabetes or heart disease?
Right, because that's a big one. And it's not something we always think about until there's a problem.
Exactly. And it often starts with something as simple as just regular checkups. Having that open communication with your healthcare providers is crucial. Be proactive about managing your medications, making sure you're attending those appointments, and really following the advice you're given. It can make a huge difference.
So we've talked about nutrition, physical activity, social connection, and managing existing health problems.
Yeah.
But we haven't touched much on mental well-being. How does that fit into the picture when it comes to preventing frailty?
That's a great point. Mental health is every bit as important as physical health, maybe even more so as we age.
Right.
It's about finding ways to manage stress, those healthy coping mechanisms to deal with life's inevitable challenges, and keeping a positive outlook. That's huge.
So what are some practical tips for boosting mental well-being, things people can actually do?
Well, one of the best things you can do is engage in activities that you genuinely enjoy. It could be anything, really. Reading, listening to music, spending time in nature, connecting with loved ones, anything that brings you joy.
All great ideas.
Yeah.
And I think those fit in with what we were saying about social connection, too. What about seeking professional help? When does it make sense to see a therapist or counselor?
Well, if you're dealing with feelings of sadness
Oh,
or anxiety or hopelessness that just won't go away, don't hesitate to reach out for professional help. There's absolutely no shame in that. In fact, it's a sign of strength and self-care. It's about prioritizing your mental health, just like you would your physical health.
absolutely. We've got to get rid of that stigma around seeking help. It's so important. So it seems like preventing and treating frailty is really a team effort, wouldn't you say?
100%. It takes individuals taking responsibility for their own health, yes, but it also involves families,
Oh.
healthcare providers, and the entire community coming together to support healthy aging.
So it's not just about what one person can do on their own. It's about building an environment where everyone can thrive.
You got it. It's about communities that value and support older adults, providing access to those resources we talked about, fostering a sense of belonging. All of that plays a role.
This deep dive has really driven home how interconnected it all is. It's not just about individual choices.
No.
It's about the bigger picture, the systems we have in place. What would you say to someone listening who's maybe worried about frailty, either for themselves or a loved one? Where do they even start?
That's such an important question. The first step is often the hardest, but it's really just to start a conversation.
Yeah.
Talk to your doctor, reach out to local community organizations, gather information about what resources are available. There's so much out there, but you have to take that first step to find it.
And don't be afraid to advocate for yourself
Right.
or for your loved ones. The more you understand about frailty, the more power you have to be proactive.
Exactly.
Knowledge is power, as they say.
Yeah. It's about taking control of your aging journey and realizing that frailty doesn't have to be the inevitable outcome. It's a challenge that we can overcome.
This whole conversation has been incredibly insightful. We've covered a lot of ground, but I feel like we've only scratched the surface.
Yeah, there's always more to learn, but hopefully this has at least sparked some new ideas for our listeners and giving them the motivation to take action.
I hope so too. And remember, it's never too early, and it's never too late to start prioritizing your health and well-being. This whole deep dive has really got me thinking differently about getting older.
In what way?
Well, it's not just about, getting older. It's about how we think about the whole process, the journey.
Yeah, I think that's a really profound insight. It's so easy to get caught up in just the physical changes, but the mental and social aspects are just as important.
Totally. And this whole discussion about frailty, it really highlights how interconnected it all is.
Absolutely.
It's not just about individual health. It's about creating communities that really support healthy aging at every level.
Exactly. It's about creating environments that are designed to be, well, age-friendly, where older adults feel included, like they belong, and they have access to all the resources that they might need.
And the article mentions Singapore's national frailty strategy, which seems like it's aiming to do just that.
Yeah.
It sounds like a pretty comprehensive plan, covering everything from prevention and early detection to long-term management of frailty.
Yeah, that's a great example of how governments are starting to recognize this. Recognizing that frailty is a public health priority. They're actually taking action on this. And it's not just Singapore. Other countries around the world are developing similar strategies to promote healthy aging.
It's so encouraging to see this kind of global movement gaining momentum. But it's not just about these big initiatives from governments, is it?
No, not at all.
We all have a part to play in creating more age-friendly communities.
Absolutely. It starts with those small, everyday actions, like checking in on your elderly neighbors or volunteering at a senior center, even just advocating for policies that make your community more age-friendly. Every little bit counts.
Yeah, for sure. And I think it's also about challenging those ageist attitudes that we see all the time.
Yeah,
We need to change the way we think about aging.
absolutely.
We need to see it as a natural part of life, not something to be feared or dreaded.
I completely agree. It's about celebrating the wisdom and the experience that older adults bring to our communities.
Yeah, exactly. This deep dive has been, it's been a real eye-opener for me. I have such a new appreciation for the complexities of aging and the importance of being proactive.
Same here, and I really hope our listeners are feeling empowered to take charge of their own aging journey and to be advocates for a more age-friendly world.
Absolutely. So as we wrap up this deep dive, I want to leave you with a final thought. What kind of legacy do you want to leave when it comes to aging? What kind of world do you want to create for yourself, for your loved ones, and for future generations?
That's a really powerful question. It really makes you think. It reminds us that we're all part of a bigger story. And our actions today have the power to shape the world of tomorrow.
Thanks for joining us on this deep dive into frailty and aging. It's been fantastic exploring these ideas with you.
The pleasure was all mine. Let's keep this conversation going and work together to create a world where everyone, regardless of age, can live a life filled with dignity, purpose, and vitality.